Hi, Dr. Raj here, and sleep disorder breathing, including physiology, is 20% of the sleep medicine board. So today, we're going to talk about total oxygen content, or in other words, what are the forms of oxygen in the blood? You need to know this. So there are two measurable forms of oxygen in your blood. What is number one? It's going to be the oxygen bound to what? Hemoglobin. And hemoglobin has 4 binding spots when it comes to oxygen. And if I were to ask you, what is it called when we want to describe the oxygen bound to the hemoglobin? We call that what? The oxygen saturation. And what is the most easiest way to get your O2 sat? You nailed it, putting on a pulse oximeter. But if for some reason you don't have a pulse, or your blood pressure is very low, or you're in an arrhythmia, or you know what? The pulse oximeter doesn't like your nail polish. What is another way to measure the O2 sat? Arterial blood gas. Okay, what is the second form of oxygen in the blood? Yes, it's called your dissolved oxygen, otherwise known as the P(a)O2, which is the partial pressure of arterial oxygen. And if you want to get that value, what is the only way to get that value? Yes, you need to order a arterial blood gas right here on the radial artery. Ouch, that hurts. And when we talk about the P(a)O2, there are only 3 things that influence the value of the P(a)O2. Number one, it's atmospheric pressure. What does it mean? Higher you go up in altitude, atmospheric pressure is going to go what? It's going to drop. So the P(a)O2 goes what? Down. What's going to be number 2? It's always going to be your minute ventilation. So what does that mean? When you are hyperventilating, what happens to your P(a)O2? Yeah, it actually goes up. And if you're hypoventilating, what happens to your dissolved oxygen? It goes down. And what is the third thing, the last thing that influences the value of the P(a)O2? It's going to be your fractional percent of oxygen. Right now, I'm breathing in what? Room air, 21%. But as I increase the fractional percent of oxygen, what happens to your dissolved oxygen? It goes up. So please, I would know these physiological pearls for your sleep medicine board exams.